Hello friends, I hope all of you are fine and I welcome you all to my channel. In this video, we'll talk about some basic informations of history taking like signs and symptoms and how does a doctor make diagnosis of any disease. Now even if you feel that these things are quite basic and very well known to you, I would still request you to please watch this video till the end because you will definitely find some new interesting information here. Well, the word history has got a totally different meaning for medical students and doctors. For us, it is not the information of our ancient times, but it is the information given by a patient to any doctor which helps him in making diagnosis of his disease. If this information is given to the doctor by patient himself, then it is called as anamnesis. But in some conditions, when patient is unable to provide any information about his disease, like some unconscious patient or uncooperative patient or in case of a small child, this information is provided to doctor by someone else, mostly by some relative of the patient. Now in such cases, this information is called as heteroanamnesis. Now broadly, the history taking is of two types. The one which we take in our student life, when we get a set of questions and we have to ask almost all questions to each and every patient, then this type of history is called as comprehensive history taking. But in its contrast, a practicing doctor asks some specific questions to his patients, which are different in different patients. Then this type of history is called as iterative hypothesis testing. Signs and symptoms. These are two very well-known words for any medical student or a doctor. Every patient visits to his doctor with only two things: his complaints and his body. Now the doctor first listens to his complaints, then he examines his body, and on the basis of information obtained by these two, he tries to make a diagnosis of his disease. Now all the information which are provided by the patient to the doctor about his disease are called as symptoms. In a simple language, you can call them as complaints. For example, fever, pain, nausea, vomiting, and many more. And all those information which are obtained by the doctor by performing examination of patient's body are called as signs. For example, tachycardia, raised blood pressure, tenderness, fluid thrill, fluctuation, and many more. Now you can call it as symptoms are all what patient says and signs are all what doctor sees. Now here are a few interesting points related to it. Some information can only be called as a symptom because they can be felt only by the patients, like pain, nausea, blurring of vision, and like that. While some features can be exclusively the signs because they can be found only after the test performed by some doctor, like fluctuation test, transillumination test, and many more like that. But some features can be either a sign or a symptom. Now let us go with an example. A patient comes to a doctor with complaints of fever and some macular rashes on his back. Now here the rashes will become symptoms because they are complained by the patient. But in other case, patient complains only of fever and doctor finds some macular rashes on his back during his clinical examination. Now in this case, rashes will become a sign. Now it's true that symptoms are what are told by the patient to the doctor, but everything which is spoken out by the patient cannot be considered as a symptom. For example, a patient says that my blood pressure has become high, or someone says that my blood sugar has become low, or some other says that I am suffering from hernia. Now raised blood pressure can be found only by a doctor during clinical examination. Low blood sugar can be found only after proper test, and hernia is a clinical diagnosis. So none of these three can be truly considered as a symptom. Now I have seen many patients that if they feel uneasiness, they call it as raised blood pressure, or if they feel weakness, they call it as low blood sugar. And if there is any inguinal or scrotal swelling, like some hernia or hydrocele or testicular tumor, they always call it as a hernia. Now such situations are quite common and they create a special problem to our young and inexperienced students. They get confused that how to proceed and what to note down. Now here's a simple solution for them. In such cases, don't challenge the thinking of the patient. Simply and smartly ask them that what is the trouble created by this raised blood pressure or low blood sugar. I'm sure that they'll definitely come out with some words like palpitation or perspiration or weakness. And these complaints can be definitely and confidently noted down as the symptoms. Now there is another problem which is again faced by our young students, is about a confusion in definition of sign and symptom. Well, believe me, some students get confused, especially in their early stages, that whatever patient says, whether it is a symptom or a sign. Now I tried to find the reason behind this problem, and it's quite interesting. We always call as sign and symptom. We don't call symptom and sign. Some students, by mistake, they start feeling that whatever is spoken by the patient is sign because it is spoken first, and whatever we find in our examination is a symptom because it is spoken last. Now, if you are also having the same problem, then there is a very interesting method to remember it. Just focus only on one letter, P, and say that P stands for patient. Now, the P comes in the spelling of symptom and not in the spelling of sign. So, whatever is said by the patient is a symptom, not a sign. Well, I hope that this simple method will help you in avoiding this confusion in future. Some symptoms are more or less specific towards the system. For example, if a patient is complaining of blood in urine or hematuria, then he is probably having a problem in his urinary system. While some other patient who is complaining of diarrhea, then he is more likely to have a problem of gastrointestinal system. But in contrast, some symptoms are quite non-specific and they can be a presenting feature of disease of any system, like fever. A single disease can present with various combination of multiple symptoms, while a single symptom can be the presenting feature of different diseases. For example, acute appendicitis can present with a combination of symptoms like pain, vomiting and fever, while a single symptom of pain in abdomen, specifically in right iliac fossa, can be a presenting feature of a large number of diseases like acute appendicitis, ureteric stone, diverticulitis, salpingitis and many more. So this list of diseases which can present with common symptoms and signs come under the category of differential diagnosis. We'll talk about it in details in some other video. The most important task of any doctor is to make a correct diagnosis of disease of his patient. Because if diagnosis is correct, treatment will be correct. But if diagnosis is wrong, the treatment may go in wrong direction. So let us see that how does a doctor make diagnosis of any disease. Now, as I told you earlier that the patient visits to his doctor with his body and his complaints. The doctor first listens to his complaints to find out the symptoms. Then he examines his body to find out the sign, and by combining these two, he tries to make a diagnosis. Now let us understand this thing with a simple example. A young male visited to a surgeon with complaint of abdominal pain. Now in his history, doctor found that the pain was in right iliac fossa and the patient was also having problems of vomiting and fever. So these all are symptoms. Now when he examined his body, he found that his pulse rate was increased, that is tachycardia, and he was having some guarding and tenderness in right iliac fossa region. So these are the signs. Now by his knowledge and experience, he combined these two information, means symptoms and signs, and made a probable diagnosis of acute appendicitis. Now this diagnosis, which is made only on the basis of symptoms and signs, is called as provisional diagnosis. Now, since he has made a diagnosis of appendicitis, shall he proceed for surgery? The answer is no. Because this is only a probable diagnosis which can be wrong also. So to confirm it, he'll first ask the patient to get some tests done which are called as investigations. Now the patient came back with the investigation reports. His CBC said that his total leukocyte counts, that is TLC, they were raised. His urine test was normal and his USG abdomen showed that appendix was swollen. Now since the doctor got more points in the favor of his provisional diagnosis, he proceeded for his surgery. But the question is, can it be called as a final diagnosis? The answer is no. During surgery, he found that his appendix was quite bulky and edematous, so he removed it. But the same question again, can we now lock the diagnosis of acute appendicitis? The answer is still the same, no. Now he sent that specimen for histopathological examination, and there it was found that there were features of acute inflammation. The treatment was started accordingly and the patient was relieved. Now at this stage, we'll call it as the final diagnosis of acute appendicitis because there is nothing beyond the word final. So in this video, we saw that what are the different types of history, what are signs and symptoms, and what is the difference between provisional diagnosis and final diagnosis and how they are made. Now I'm sure that some of you may be having some questions at this stage, especially our young students. Number one, is it essential to confirm your provisional diagnosis by investigation? And number two, if it is essential to send the patient for investigations to make a diagnosis, then what is the sense in spending so much time in taking his history and in performing his clinical examination? I'll talk about it in details in my next video, mainly about what is the role of investigations in our field and why is it essential to take proper history and to perform methodical examination of each and every patient. If you found that this video was quite informative and interesting for you, then please like it, share it and subscribe the channel. We'll meet again very soon with my next video. Till then, stay healthy, stay safe and always keep learning in your life. Goodbye.